My name is Carl. I'm a paediatric emergency medicine doctor. Today we are going to talk about autism. This talk is intended for healthcare staff looking after children. April is Autism Awareness Month. What are you planning to do in your department? So, what is it like to really have autism from the perspective of a child? Scan the QR code now or click link 1. What about terminology? What about Asperger's syndrome, autistic disorder, or high-functioning autism? All these terms have largely been dropped in favour of the DSM-5 and ICD-11 diagnostic term autistic spectrum disorder. Autism is still used for shorthand, but it is important to ensure you ask the person and/or their family what term they prefer, as they may have a preference. What is autism? When does it start? Is it a learning disability? How common is it? Autism is a lifelong neurodevelopmental condition, not a learning disability. People with autism can have a range of cognitive ability. Autism impacts how you understand and interact with the world. It affects how you communicate with others and influences your behaviour as a result. It affects approximately 1 in 100 people, but rates may be much higher. The male to female ratio appears to be 3 to 1, but women are frequently underdiagnosed. What causes it? There has been a lot of research and a great deal of public interest. However, we still don't really know. Research suggests a combination of genetic and environmental factors that affect brain development. We also know that autism can run in families. Very importantly, there is no link between autism and vaccines. Furthermore, it is important to understand people cannot help having autism, and nor can their parents or families. It is nothing to do with parenting, and it is a condition that, whilst diagnosed at different ages, is present since birth, having likely developed in utero. An autism diagnosis largely centres around characteristics relating to social communication and interaction. These can vary from non-verbal children to those with repetitive speech and behaviour to those with particularly sensory aspects. The saying goes, if you've met one child with autism, you've met one child with autism. There are no two children with autism who are exactly alike. To make things more difficult, these characteristics can sometimes overlap with other conditions. Furthermore, autism is more associated with these comorbidities compared to the rest of the population. An important principle is that autism is not inherently pathological. It is simply a different way someone thinks and behaves. Please scan the following QR code or click link 2 in the description to watch a video about amazing things happen. In the case of autism, a child may know a lot of words and may be able to talk fluently, but could still struggle to understand what another person means. It is not the language that is difficult, but the meaning. For example, a person might say during a rainstorm, "Nice weather today." Tone and context suggest sarcasm. The weather is in fact awful, and this meaning might be lost by a person with autism and hence be confusing. Reading between the lines, drawing inferences from what is not said as well as what's said, and linking separate pieces of information together might seem obvious to some, but can be very difficult for a person with autism. The purpose of understanding verbal differences in autism is to foster understanding and improve how we speak and listen when looking after children with autism. You may notice a monotonous tone. You might feel talked at. Speech might be repetitive, and there may be a strong focus on a particular interest. Sometimes responses can be misunderstood as being rude. In truth, the meaning is more likely that they are direct and being literal without any rude intention. Non-verbal communication can also differ. There may be inconsistencies with eye contact, gestures, facial expressions, and sometimes facial expressions may be exaggerated. It is important to dispel a few myths. For example, the idea that those with autism do not want to interact with others. People with autism often want to be social, but being social is more difficult for them. I certainly have met incredibly affectionate children with autism who are deeply compassionate and indeed care greatly about others. Dispelling such myths is something that Hannah Gatsby is achieving through sharing her personal experiences of autism and neurodivergence. She does this through comedy, and aside from anything else, it is absolute gold and a must watch. Scan the QR code here or visit link 3. Hannah talks brilliantly about her experience growing up with autism. She shares her difficulties in interacting with others. Things like not understanding others' facial expressions and having her own facial expressions mistaken for disinterest. Things like taking insults literally or having a poor understanding of others' personal space. While she has an awareness in her case of social rules, she simply doesn't understand them. She has to constantly adapt to a world that was never designed for her. She has learnt to take turns in talking with others, adhere to arbitrary social rules, and despite this knows she can come across overly formal or inadvertently familiar. When considering a child struggling in a healthcare environment, it is able to summarize some important difficulties. They may be struggling to imagine what is going to happen next, and therefore feel anxious about the unknown and the change from routine. They may be fixated on an idea that something painful or bad is going to happen, like a blood test, and struggle to think flexibly. They may struggle with the unpredictability of waiting times, changing plans or unexpected actions, like the need for a test or hospital admission. Anyone in this position might feel confusion or anger. They may want to know a lot, ask lots of questions like what is going to happen, when, where, why, and with whom. In turn, they may be challenged and have difficulty if given too many choices, and may struggle to organize their thoughts in responding to questions. Repetitive movements like flapping or spinning can result. There may be an insistence on following a particular agenda that is different to their parents or healthcare provider. Understanding this helps us to empathize and build up understanding as we communicate and plan their care. Whilst this may vary from child to child, consider whether noise, light, or the sensory environment might be overwhelming them. Of course, avoid assumptions. Some children may seek out particular stimuli like touch rather than withdraw from such. Again, no two children are the same. Ask the parent what is helpful, what is unhelpful, what they like, what they dislike. In order to speak truth to how autism is not inherently pathological and how it is a spectrum like any other, with strengths and weaknesses, let me spend a moment just drawing attention to a series of strengths that it affords. For example, some children with autism may have enhanced focus. Others may experience and demonstrate deep devotion in their friendships and relationships. Some may exhibit incredible creativity or originality. Indeed, the Association for Autism and Neurodiversity summarize many advantages as shown here. Equally, it is important not to shy away from the immense struggles some children and some families have. Dysregulated behaviour can be caused by a number of things, including sensory overload. Parents might label this as a meltdown. It is important to recognise the stages of this and the experience of children and parents in this regard. Please scan the following QR code or visit link 4. This powerfully emotive video gives insight into the lived experiences of some families. In the video, the father explains how they intend not to shame their children by sharing the footage. Instead, they hope to provide an honest window into their lives so we as professionals can better understand their lived experience. So what can we do to help? Maintaining a strength-based attitude and utilising a series of strategies can go a long way. Actively thinking about your own communication, using a low sensory approach and considering the environment. Provide positive reinforcement, recognise and role model coping strategies, and provide predictability and routine where possible. Be clear and literal in your choice of words. Avoid unnecessary information. Keep things short and concise. One thing at a time, one instruction at a time. Avoid saying what not to do. Instead, keep it simple and positively communicate what it is you do want them to do. Do not insist on eye contact and never try to stop repetitive behaviour or stimming, as this might be their way of coping or communicating distress. Whilst there isn't time now to go into detail, further tools for communication include visual timetables, communication passports, social stories, and comic strip conversations. Further ideas that can support emotional regulation include self-soothe boxes, fidget toys, and movement breaks. What about when things become a crisis? Ask the parents or carers what helps. Use a low stimulation environment. Follow any pre-existing behavioural management plans. Consider dimming the lights, avoiding loud noises. Use verbal de-escalation whilst being mindful of points raised in this talk. Oral medication should be a last resort. Intramuscular medication is a last resort. Chemical restraint should never occur without senior professional input. Document causes of distress or triggers, and document what worked well. General positive principles include listening more and talking less. Avoid you must or you need statements. Be simple and clear. This talk, whilst informed, is not the opinion of a specialist, but simply that of an interested health professional. Always take advice from a qualified mental health or child development professional. Together, families, education and health services can work together to improve the care we provide for those with autism. Additional summaries can also be found at the National Autistic Society's website. Here are some helpful aid memoirs from Don't Forget the Bubbles for when you are next communicating with neurodivergent or autistic children. Thank you for listening.